Good morning, everybody. Welcome back to the channel. So I want to start this video with a patient that I think about quite a lot, the kind of case that I've seen far too often in my career over the last 10 years. So a man in his 60s woke up one morning with a very heavy, tight feeling in his chest. It eased off after about 5 or 10 minutes or so, and he just put it down to indigestion, heartburn, as many people do. He then had his breakfast and he just carried on with the rest of his day. 2 mornings later, though, he woke up with that same feeling in his chest. Only this time it didn't go away, and he arrived in my A&E having a heart attack. And the really annoying thing about this, well, not annoying, but sort of frustrating and disappointing, is that he'd ignored the very symptoms that his body was giving him, this huge warning sign that he was about to have a heart attack. Now, what a lot of people don't know is that the morning is statistically the most likely time of the day to have a heart attack. Partly because your blood is a bit thicker, it's a bit more viscous and stickier after a night without a fluid because, you're a bit more dehydrated. You've been breathing out lots of water vapor and sweating a bit, so you're a bit more dehydrated. And partly because the moment that you wake up and you get up onto your feet, your body sends your blood pressure surging upwards to deal with that sudden demand of needing to perfuse your brain and all of the organs because of gravity now. But a heart attack is far from the only thing to be aware of first thing in the morning. And that's really what this video is about. It's about educating you and making you aware of the signs to look out for so you know what they mean and what to do if you experience them. My name is Dr. Alex. I'm an emergency medicine doctor, if you haven't already guessed. And in more than 10 years working on the front line in the emergency department, I've learned which morning symptoms are worth watching and paying attention to, and which ones mean that you need to act really fast. So I'm going to take you through just 4 sort of morning signs and symptoms that your heart might be struggling, and we'll go through them in order from least concerning all the way through to the most concerning with exactly what to do about each one of them. And as always, if you learned something from today's video, then please help me out by subscribing, liking the video as well, and also giving the video a hype. So let me start by quickly explaining why the morning time is such a vulnerable time for your heart, because everything else we talk about sort of leads on from this. So when you sleep, your body winds right down, your blood pressure dips, and your heart gets a proper rest overnight. But in the hour or so around the time that you wake up, everything in your body fires up at once, including our stress hormones, which are cortisol and adrenaline, which surge to get you going for the day. And they push your blood pressure up pretty sharply, often by 10 or 20 points or so within that first hour, and then more again in the first few minutes after you stand up. At the same time, like I've just mentioned, your blood is naturally stickier and a bit thicker in the morning as well, partly because you've gone all night without a drink, which makes your blood more prone to clotting because it's thicker. So you've got a rising blood pressure, a faster heart rate, and stickier blood all landing together as soon as you wake up. And that combination is exactly why heart attacks and strokes and dangerous heart rhythms are most common between 6 o'clock in the morning and midday. This is the pattern that we see in the emergency department. So if your heart has a hidden weakness, then the early morning is when it's most likely to show itself, which is why this video is aimed at morning symptoms. So let me take you through those 4 signs then, starting with the least concerning. So the first sign, and the least alarming one on this list, is feeling exhausted even after a full night's sleep in bed, or what you think is a full night's sleep in bed, especially if it comes on with loud snoring overnight, or your partner notices that you wake up gasping and you stop breathing for a few seconds at a time quite regularly through the night. This pattern could point to a condition called sleep apnea. And this is where your airway keeps collapsing through the night, and your oxygen levels as a result dip frequently again and again when you're trying to sleep. And every one of those dips makes your heart work harder and your blood pressure climb. So over time, it puts a real strain on the heart, and it raises your risk of high blood pressure and irregular heart rhythms, and also heart attacks and heart failure. So if all of that sounds familiar, what do you do? Well, obviously this isn't an emergency. You don't need to be calling an ambulance, but I wouldn't ignore it. I would still book a routine appointment with your GP and ask about a sleep assessment, because a proper diagnosis and the right treatment for obstructive sleep apnea really can protect your heart enormously over years. But while you're waiting for that appointment, because if you live in the UK, we know it's going to be probably a few weeks before you can get that sleep assessment, you want to start working on the basics that help this condition in their own right, which are like losing a bit of weight if you need to, sleeping on your side rather than on your back, because when you're on your back, all of that weight around your neck can press on your airways. So if you lie on your side, then that eases the pressure a bit. But probably the biggest one in the UK is cutting back on alcohol, well, in general, but particularly around the time that you go to bed. And the reason this one is important because alcohol literally relaxes your airways and makes both the snoring and the breathing pauses overnight much worse. So try and do those things if you think this could be relating to you, and then let the GP, let your family doctor take everything else from there. The second sign is noticing that your heartbeat feels a bit odd when you first wake up in the morning. Maybe it's racing or fluttering a bit, or thumping as well, or skipping beats while you're just sort of simply lying there as you're waking up. Now, the occasional skipped beat is usually harmless. Now, coincidentally, I'm getting a few palpitations this morning. I don't really know why. It's probably because I'm a bit tired because of George, and I did a couple of workouts yesterday. So, my body's going through a bit of a stressful time, I guess. But, I'm not too concerned. This feels like my heart is just sort of pounding just for one beat every few minutes. I've got no other symptoms. I feel otherwise fine. A bit tired, but nothing major. So that sort of feeling like your heart is skipping a beat is really common. And as long as you feel well and there's no other symptoms, then generally it's harmless. But a pulse or heartbeat that is irregularly irregular, where there's no real pattern to it, it's just a bit all over the place. This could be a sign of something called atrial fibrillation, AF, which is the most common abnormal heart rhythm, where the top chambers of the heart, the atria, they quiver sort of really randomly and really quickly rather than beating quite regularly as they are supposed to do. And this is worth taking really serious because atrial fibrillation, it lets your blood pool in this sort of stagnant state in the atria, and it lets the blood clot inside the heart. And that clot can then travel up to the brain and cause a stroke. So here's what you want to do. You want to take 30 seconds when you wake up while you're still in bed to feel your pulse at your wrist, the radial artery, and sort of pay attention whether the rhythm is steady like a clock or whether it's jumping around with no pattern at all. If it's irregular just now and then, and it's coming and going every so often, and you otherwise feel well with no breathlessness, no pain anywhere, no odd feelings in your chest, or no lightheadedness, then that is something that your GP or your family doctor can deal with. So just book a routine appointment for that one. And what they'll do is they'll arrange an ECG, a tracing of your heart, and also do some basic blood tests as well. But if your heart is racing or your heartbeat is irregular and it won't stop, or you feel faint or unwell, or you've got any sort of chest symptoms at all, then you don't want to wait for this. You want to be calling an ambulance, really. And the final thing to mention here is that these days you can get a smartwatch quite cheaply, which will keep an eye on your heart rate and your heart rhythm as well. And some of them are really good at detecting atrial fibrillation. It can't really do a full ECG, obviously, just by being on your wrist. But if this is something that happens quite regularly, then your Apple Watch or your Google Watch or another sports watch can keep an eye on this for you and alert you, when your heart goes into an odd rhythm. The most important thing is, if you feel unwell with any of this, then just call an ambulance. So the third sign is a bit more serious now, and it's waking up unable to catch your breath. Now, there are two different patterns here, and we've got names for both of these. The first one is what we call orthopnea, which simply means breathlessness when you lie flat. So you find that you can't lie down properly anymore without feeling short of breath. So bit by bit, you've started propping yourself up on more and more pillows just to sleep. And what we do find that, sometimes people have to sleep upright in a chair, and they do this for years before they ever even mention it to a doctor. So if this is you, if you get breathless when you lie flat, or you need a few more pillows than you did 6 months ago, we've got to be paying attention to this. The second one is called paroxysmal nocturnal dyspnea, PND, and that essentially just means sudden at-night breathlessness, paroxysmal nocturnal dyspnea. Now, this is where you wake up a couple of hours into being asleep, where you wake up gasping for air with a frightening feeling of suffocation that forces you to sit bolt upright and throw open the curtains, throw open a window to get your breath back. Now, let me explain what's going on here, because this one is not to be ignored. So your heart is basically a pump. It is a muscular pump. And when it's struggling, it can't push blood sort of away from the heart as fast as it arrives back through your veins. So what happens is the fluid backs up behind it into your lungs, where it shouldn't be. Think of your lungs a bit like a sponge that slowly gets waterlogged over time. So during the day, while you're upright, gravity pulls that spare fluid down into your legs and your ankles away from your lungs. So you breathe well enough during the day. And this is why people with early stages of heart failure first notice swelling in their ankles during the day, because that fluid is draining downwards. But the moment you lie flat, gravity stops holding it there, and all of that fluid then drains out of your legs and floods back towards your chest. Now, a healthy heart would simply pump it straight on through, but a struggling heart can't do that, so it pulls all of that water, all of that fluid into your lungs. Your sponge, your lungs, then become soggy, and you feel like you're slowly drowning, because the more water there's in your lungs, the less space for oxygen. And that is exactly why sitting up really helps, because it lets gravity pull all of this fluid back down out of your lungs. So these are the classic warning signs of what we call heart failure, where the heart cannot pump strongly enough to keep up. And these are not symptoms to ignore or just keep an eye on over the next few months. So here's what to do if any of those symptoms apply to you. So if you're regularly waking up feeling out of breath, or in any breathlessness at all, or you need extra pillows just to breathe comfortably at night, you need to be seeing a doctor pretty soon, within days rather than weeks. And if you ever wake up with sudden severe breathlessness that isn't going away, especially with chest pain or a blue tinge to your lips or fingers, then you've got to treat that as an emergency and call 9999 straight away. Now, the fourth sign is the most serious one out of all of them, and it's any new chest tightness or pressure or pain in the morning, particularly when you first start moving around, like getting washed and getting dressed, when pain spreads across your chest. Now, people often describe it as a heaviness, or like a band around their chest, or a heavy weight pressing down on the chest, literally as if an elephant is sitting on them, rather than a sharp stabbing pain just here and there. Now, this sort of pain can spread to your arms, into your neck, into the jaw, or into your back as well. And it often comes on with sweating or feeling really sick and breathlessness as well. Now, when it comes on with effort, like walking up a hill, and then it eases off with rest. This is what we call angina, stable angina, where it always eases when you rest, which is a warning that your heart muscle isn't getting all the blood that it needs, that there was a blockage somewhere. But when these pains come on and they don't ease, or they come on with rest and don't ease at all, then this is what we call a heart attack, which is exactly what happened to the man that I told you about at the start of the video. So this is the one sign where you absolutely should not be just watching and waiting. If you get any new chest pain, or pain that's worse than anything that you've ever had before, or that lasts more than a few minutes, then just call an ambulance, call 9999 or 911 or whatever the number is where you are. Just call it immediately. It's always, always better to be safe than sorry. Don't be driving yourself. Don't be waiting for your friend to come and pick you up. Just call an ambulance, because think of the worst case scenario. Just imagine it is a heart attack and you've waited half an hour. That is an extra 30 minutes of your heart muscle dying that will never grow back. I promise you, every single minute counts with a heart attack. And an extra 30 minutes or 60 minutes could be the difference between surviving that heart attack and then living to the age of 90, or not surviving it and that being your final day. It sounds so morbid, but at least you've got all the information now. So those are the 4 warning signs to be aware of. Remember, most morning aches and pains are completely harmless, and the point of this video isn't to frighten you, but it's to help you tell the difference between what can wait and what cannot wait. The simple rule in my head anyway is this. So tiredness with heavy snoring, or irregular that comes and goes, usually means to book a GP appointment and to work on your habit in the meantime. Breathlessness that's slowly building up means to see a doctor within a couple of days if you can, and sudden severe breathlessness or a pulse that won't settle or any sort of chest symptoms means call an ambulance without hesitating. And please, please, please never feel like you're being a nuisance or wasting our time for coming to the hospital and getting your heart checked. Because in all of my time working in the emergency room, I've never ever once thought less of somebody for coming in. I've only ever wished that somebody had come in sooner. So always think of the worst case scenario, particularly if you're over the age of 50, and just always do the sensible thing and get checked out.